Well, good evening, everyone, and welcome to our virtual family council meeting. My name is Jamie Rose, and I'm your virtual meeting coordinator. So we're going to start our meeting off tonight with our confidentiality reminder. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you connected to your assigned ombudsman. And just a reminder, these calls have public access and are designed for family members and friends of residents in long-term care facilities. So without further ado, I'll turn it over to Mr. Rotz for our virtual meeting tips.
Good afternoon, everybody. First of all, you've all been placed in mute upon entry. We'll open the lines in a little bit so that you're able to share. If you would like to speak or have a question, please use the raise hand feature. Once you raise your hand, we will know to acknowledge you and unmute your line. If you hover your mouse near the bottom of your screen, you should see the Participants tab. That can be expanded if you'd like to see that. The chat feature is at the bottom of your screen as well. Once you maximize it, you will be able to send questions to the chat moderator or others during the call. Closed captioning is available during the call. To enable this feature, push on the CC icon at the bottom of your screen and choose to enable closed captioning. If you need to step away, you can stop sharing your camera by clicking on the camera icon at the bottom of the screen. You can click on it again to start sharing your camera again. And finally, if you have any concerns or complaints, they can be directed to me at the State Ombudsman Office. That number is 717-783-8975 or by email at lpc-ombudsman@pa.gov. And without any further ado, I would like to turn it over to Irma Rappaport. Irma?
Thank you very much. I love the introduction with that beautiful background. Thank you. It's very nice to be able to see people. If you want to join with the I'd love to see your faces. I joined this so that I could see faces instead of messaging people on Facebook. And as I was saying, I didn't even belong to Facebook until a month ago so that I could do this work. I'm a former caregiver. I would be at a family council meeting for sure, I know, if I was still one. But my mother, who I had been taking care of for 11 years, 1 year in my house, 4 years in assisted living, and 6 years in a nursing home. She had Alzheimer's. She had different needs that I helped her with specifically. By the time the lockdowns happened, I had been helping her 7 days a week, at least 3 times a day, getting her up, putting her to bed, helping her eat, brushing her teeth, all those things that an essential caregiver does. And I was isolated for 11 months. So I was at her window, which was always closed, 3 times a day to see. She was always in her room, isolated, by the way, as you know how it went. I wanted to see how she was eating at every meal, how she was sitting up in her wheelchair. And I had to point out a lot of things to them, and they were so overworked and overwhelmed, they would get angry sometimes, of course, if I was asking them to push her drink closer so she could actually drink, things like that. And then the worst thing that happened was when she was moved to the other side of the building during that year. There were different reasons they seemed to want to move people around. And I didn't know until I was told by them. I'm in Connecticut, by the way, I'm in Connecticut, and I'll tell you about that. I was told that she was unresponsive when I went in. That was the only time I was finally allowed in after 11 months. I wasn't allowed any compassionate care visits. When I went in and it was February, there was snow outside and the window was closed. It was so hot in there. And an aide told me later it was the hottest room in the building, and I had no idea. She was bleeding. Her lips were bleeding at both corners. She was totally dehydrated, and she died a couple days later. And this is the story I often tell at these meetings I have. Well, when I heard about the bill afterwards, this was a month before the year anniversary where people were marching with the isolation kills signs. And we did that in Connecticut. We had several places in Connecticut we went to. And our next step was to try to get our representatives to co-sponsor. Our Representative Larson, John Larson, is what we call now the co-leader of the bill, the Essential Caregiver Bill, with Claudia Tenney in New York. So he's the Democrat and she's the Republican. And we have 4 other representatives in Connecticut. One other one co-sponsored right away. And then 3 more were left. One was my representative, Rosa DeLauro. And I tried emailing, calling all the time. I couldn't get any response. And then last January, I heard someone tell me that they had heard from someone at a national meeting of some kind that you have to contact your health assistant. The health legislative assistant is their title of the representative. So I had just at that moment started contacting the chief of staff for the representative, and she had actually replied to me, but they said, well, the only one who has the power to get the representative to co-sponsor is the health assistant. So I called up the DC office. I said, who's this health assistant? Then I emailed her asking about the bill, and I emailed my story. I typed it out in 1 page and I attached it to the email. And then she responded to me that she was going to ask her to co-sponsor, and she thinks it's likely that she would. And within a few days, she did co-sponsor. Now, it was difficult, especially we have all Democrats in Connecticut, you can imagine. Then I helped the other 2 to co-sponsor the same way. I made connections. One of the other districts in Connecticut was where my mother was from. So I mentioned that in the email, anything to make a connection. So we have all of our representatives in Connecticut have co-sponsored the bill. And there were about 30 co-sponsors of the bill last May. I spent time all winter. I called up every office in the United States to find out the current names of the health assistants, and I typed up lists. And then I posted them on Essential Caregivers Coalition. There's circles for each state, and if you go there, you'll see my post for Pennsylvania with the current, and then I always make sure it's updated. I edit it if there's a change. And I didn't see really anything happening. I didn't see any new co-sponsors coming out of my postings. So then I joined Facebook on Mary Daniel's advice, and I decided last month to just start doing it myself. There's 2 other women in Connecticut that help me with, figuring things out. And I showed them a letter that I had thought of emailing to the health assistant of every district in the United States, except Texas. Texas has a special case where they got a bill amending their constitution in their state. And they just want to do things for Texas, and that's fine. We have a wonderful leader of Caregivers for Compromise in Texas. But other than that, and New Jersey too kind of wants to do things themselves. Other than that, I wrote to every representative health assistant, and I got many responses. Since last beginning of May, I've had almost 60 meetings with different health assistants, and I got 9 new co-sponsors. So, and that was just based on my original letter. Even 2 of them decided to co-sponsor just based on my email. And I would say that about 95% of the people that I went to the meetings with, the health assistants, said they never heard of the bill. So if you're wondering why this bill isn't being co-sponsored, they were telling me they never heard of the bill. They're very young, most of these health assistants, but that's not an excuse. They never heard of it. And then I would ask them, do you have any personal experience of knowing someone in a facility during the past 2 years? Sometimes they did. I just wanted to make it more relatable for them. Sometimes they didn't. So some of the meetings at first were not with constituents, meaning somebody in that district of the representative, the one who would be voting for them. And I found out within a few weeks' time, that's really who they would prefer to see at the meeting, not just someone from the state. But I was just writing, there's 435 representatives in all of the United States. So I was writing to all of them except Texas. And I even wrote to New Jersey, like I said. I got so many responses, I didn't have time to even find constituents at first, but now things are ebbing a little bit. And I have time to find constituents, and I'm focusing. I would be very happy if anyone is in a certain district in Pennsylvania. I have a special letter that I send them as a follow-up. They've already gotten at least one email from me saying, I have a constituent in your district, and I give the name and the town or city that you're in. And they would like to join us for a meeting to discuss the bill. And then I often get a response because of that. They can't say no because I have an actual constituent. And then it's a half-hour virtual or phone meeting. There were only a few phone meetings, it was usually on Zoom, which I set up. And I start the meeting and it can be at the convenience, your convenience. If it's good for your schedule, that's what I ask first. What would be a good time to set up a meeting? And then I ask the health assistant if that's a good time for them. So I ask them if they ever heard of the bill, if they had anyone in a facility. And then I say a couple sentences about the bill. It's only a 3-page bill. It's a very simple bill to understand. If anyone here doesn't know what the bill is, it's just about having 2 essential caregivers allowed in during any public health emergency for up to 12 hours a day, while they have to follow the same safety protocols as staff. And it's all in writing, and they're not allowed in if they don't follow those safety protocols. So that's all there is to it. Once the bill gets what they call marked up, there could be changes made. But this is what the bill is right now. This is what we're asking them to co-sponsor. And another thing I learned recently is that it's important to get co-sponsors from the 2 committees that the bill was referred to. And those are the Ways and Means and Energy and Commerce committees. So I looked up for Pennsylvania. In the Ways and Means, there are 3 representatives that haven't co-sponsored yet in Pennsylvania. And there are there's 2 for the Energy and Commerce. So if we get those, that would be very good. But again, I would be happy to have a meeting with anyone here that has, it lives in a district that hasn't co-sponsored. And if you don't know who your representative is, you just go to house.gov. I'll email you that information, Jamie, and you type in your zip code and it tells you the name of your representative. And I know who their health assistant is, and I would set up the meeting. Thank you. Do you have any questions, please?
I actually am typing one while you stop, so I'll stop midstream, but.
Did I say that we got 9 co-sponsors since last May? So.
That's
yeah,
great.
That
great.
was a good thing.
Yeah, I started typing it, but it didn't.
Jim's, let's
Jim
see.
has,
no, I'll tell you who the ones in, I actually just typed up a list by state, but I'd have to go into that spreadsheet. So Dan Muser, he's a Republican in District 9. And then one that I got this month was Brian Fitzpatrick. And he's in District 1. And an important thing about him is that he's a co-chair of what's called the Bipartisan Problem Solvers Caucus. Josh Gottheimer is the Democratic co-chair in New Jersey. And that's an important caucus to this committee, I was told also. So I think it's only those two so far, Daniel Muser and Brian Fitzpatrick in Pennsylvania. So there's plenty left. And it's very difficult when I try to message on the Facebook of Caregivers for Compromise. I look up towns and cities. Sometimes they'll list that next to a person that they say they live in such and such a city. And then I message them. Once in a while I'll get a response, but most of the time I don't. So meeting somebody like this personally, if you were all in a different district, imagine how many meetings I could probably get. There are 17 representatives left here that we had only one meeting so far with District 13, John Joyce. I met with, I found a constituent. You know how I found her? We have this book. Does anyone have this book, Protecting Them to Death, that came out by Caregivers? It has stories from all 50 states. I have a digital copy of it now, and I can email it to anyone who wants. I'm going to be giving my email information to Jamie she'll post it, and anyone wants a digital copy, I'll send it to you, and hopefully you'll say that you'd like to attend a meeting too, and tell me your representative and what town you're from, please. Okay, anyone else? Oh, I see another chat. Anyone else want to say something? Let's see. Send me the link for the bill. Great. Yes, I'll send the link too. I'll send everything to Jamie. She'll forward. I'll send a link to the bill. There's an infographic of the bill. These are things that I always share with the health assistants. A summary of the bill, the names of the co-sponsors, and a digital link to the book. And also, there's one other great thing that happened from all this work. Remember when they have the U.S. Capitol introduction with Claudia Tenney and John Larson that they showed on the internet if you weren't there in person? Last June, on the steps of the Capitol, a bunch of people from the Caregivers for Compromise came to talk about the bill. So two of them, like I said, these other women I work with in Connecticut went to that DC occasion, and they were told by John Larson that he was going to give a Dear Colleague letter to all of the representative offices saying you should support this bill. Well, we never saw this letter. And then after all this work, Liz and Amy and I had a meeting with John Larson's assistant, Mike Dunn, Zoom meeting a couple weeks ago, and he typed up the Dear Colleague letter, and now I will show you that too. Now I can attach it to all of their emails to the health assistants. And it presents, instead of making it like it's about Claudia Tenney because she was the first one to agree to the bill, she even said, I watched the video again from last year in DC. She says at this meeting on the Capitol, this is my co-leader, John Larson, and this is how he's presented now as they are the two sponsors of the bill. We present it, and everyone else is a co-sponsor. So he's elevated above them. He's equal to Claudia Tenney. So anyone who is a Democrat and is afraid to sponsor the bill, it shouldn't be. We say this is a human rights bill. It's not a left or right bill. So that's about all I have to say. And everyone here, I hope that you will be able to help. It's very, very simple. The meeting, you just tell your story for a couple of minutes, what it was like during the lockdown, what you did for your loved one before, after. There's a fear of retaliation when you still have somebody living in the facility. You might feel like, I hope not, but I do hear there's a fear of retaliation from the facility for speaking up about anything. But first of all, like you just said here, you don't say what what the name is of the facility, and you're just asking for this bill to be co-sponsored. You're not complaining about if you have any complaints about the nursing home, you're not complaining about it. You're just saying what you did, what you do for your loved one, and why this bill is needed, because CMS guidelines are being ignored. State laws are sometimes being ignored. This bill, and it explains that in this book too, about the differences between those other kinds of guidelines and laws and a federal law. These are federally funded facilities that take Medicare and Medicaid. They need a federal bill.
Irma, there is another question in the chat. Linda Gibson is asking if there is a deadline for your advocacy.
Not at the moment. No. John Larson's assistant says, keep working on it. He says it's like you're not going to get it passed unless you're working on it. And I think we're making progress. Until I email him weekly summaries of the meetings and other things. So till he tells me this bill is dead, I'm going to keep going with it, because I'm very upset about what happened to my mother and other people. And this is the best thing we have right now to ensure that that doesn't ever happen again.
I'm curious, if they don't sponsor it, did they ever give you any reason why they don't want to sponsor it?
No, not yet. I've been following up every 2 weeks after a meeting with another email. And sometimes I get a response, we're still looking into it, but nobody has said, no, I'm not going to sponsor it. No, I do ask them to tell me if they're not, but no. So it's all still on the table for all of them. And then another thing you should all know is, like in the case of Connecticut and North Carolina, in North Carolina, I got 2 Democratic co-sponsors, and once one did, the other one soon followed. The same with Connecticut. Once I got my representative Democrat to co-sponsor, 2 more soon followed. So it's certainly possible that can happen, Republican or Democrat, in a state. That's why I always mention the emails, like I would tell anyone in these follow-up emails that Brian Fitzpatrick has just co-sponsored the bill. So they seem to like to hear that someone else in the state has sponsored the bill.
We did have another comment saying that sometimes a false deadline isn't such a bad idea because the long-term effect of COVID is not going away. And people forget, unfortunately, they forget shortly about what.
I do feel an urgency about it, because in all the different states, I hear about outbreaks and lockdowns. I think Connecticut seems to be doing pretty well for the most part, but it bothers me that other states are not. And again, that's why we need a federal bill for everybody to have the same fair. It's not fair for one state to get one kind of treatment and another one not.
Well, I thank you so much, Irma, for sharing your efforts, and it sounds like you're got a well-oiled machine going there. So hopefully we can get a couple of our Pennsylvania folks to help you out. This is a great group, and I don't doubt that you'll have quite a few emails after we get this sent out for you.
That's wonderful. I will send out all the information tonight to you.
Fantastic, because we send a follow-up tomorrow, so they'll get a link to our chat, and then they can get that follow-up information.
I have a 1-hour meeting now about we're trying to get AARP to support this bill. That's what this meeting's about. And after that, I will send you the information. I'm so happy that you all heard what I had to say, and I look forward to you participating in this worthy thing, because that's what this family council is about, being able to be in there.
That's right. Thank you so much.
Okay. Thank you.
We'll see ya.
Okay.
All righty. I was trying to talk fast because I know Irma had to jump. She's a busy lady. So now we're going to open up officially for open discussion. So if anybody has anything they would like to bring to the table, comments, questions about the virtual family council, any ideas that you have. I mean, this could be anything from you like the 2 every other week meetings to our follow-up emails. Like, this is the time for us to get the nitty-gritty good information from you. We do have several members of the work group here too, so you guys can feel free to share. I did want to put out a little plug. If anybody wants to join the work group for the virtual family council, we would love to have some folks on there. I believe we're down to about 5 people. That's really our think tank. So if anybody would like to join and share your ideas, we meet every other week, usually Friday mornings at 10 on Zoom. So if anybody would like to jump on, let us know. Oh, we got a couple things here. Okay, so a guardianship discussion and how people transition with a guardian would be helpful. You can definitely, it's been a while since we did anything for guardians. I think we had a video, what was it, about a year ago, Carol, we did something with power of attorneys and guardians.
Yeah, it's been a while.
Absolutely, that's a good one. That's a very confusing topic for some folks.
I put in there that I'm wondering with the families, if there was certain things they wish they had known when their loved one was first admitted to a facility. And then I guess maybe we have to think about that one a little bit. And then Corey had written in that NC Nickler has some great materials on guardianship. We can reach out to them to see if they would speak at one of the meetings, and that would be great, Corey. There is a question here from Jody about how can ombudsman help when a guardian is involved around traditional services. Can I say something? Maybe this isn't what the person was thinking of, but like if somebody's in a nursing home and they have a guardian, in theory, the person is supposed to visit so many times and everything. But of course, I think with the COVID story, it knocked everything out of it didn't happen, but now they should be back to, visiting, not to say anything negative about, but, sometimes they don't really come and see the person, but yet they bill for charges for, helping them or whatever. But so an ombudsman could be advocating on behalf of the person that has been adjudicated incapacitated if we felt it was necessary.
Yeah, those get a little complicated for answering it without the particulars. So I would encourage you, Jody, to reach out to your local ombudsman if you're not sure who that is. Put that in your county in the chat. We'll make sure we get you connected to that person.
And then we have Ed saying that Brian Fitzgerald needs another sponsor with the Essential Caregiver Bill, and that maybe Representative Daley could be, maybe he could reach out to Representative Daley. That would be great. And then,
I'd be glad to connect them.
That's awesome.
wonderful.
Well, Brian's a good guy. Rep Daly, she's smart. Good combination.
There you go.
Great.
Of course, you realize the political climate in the Senate is not exactly democratic.
We have a suggestion about the leading age being a speaker for us, for American Health Care Association, about pending legislation, timetables, updates about changes planned for the nursing home industry. That would be good if we could get them.
We do have some connections to leading age, so we'll reach out. I just wanted to put a bug in everyone's ear too. I'm going to be attending the Pioneer Network Conference in Denver, Colorado at the end of the month. I'm hoping to make some friends there. Maybe we'll get some potential speakers from there as well.
There was a question as well about personal care homes. And I know personal care and assisted living always kind of get the back seat to nursing homes because there really aren't federal regulations. So they don't get that, that wide federal attention that they deserve. So as far as we know, and Jamie can clarify, there really hasn't been any progress on changing regs for personal care homes or assisted living. Usually they follow suit with the nursing home, just like with COVID this whole time, we essentially had to wait a few weeks or even months for personal care homes and assisted living COVID guidelines to even catch up with nursing homes. So hopefully with some things in the chute with the nursing homes, personal care homes will follow.
Absolutely. And you're completely right with that, Corey. Usually it is just a matter of time, and they have been talking about doing some updates to some of their, I can't remember when the last one came out. Was it 2009 for personal care homes? It's been a minute. Then assisted living came, obviously that was their first run for licensure. So they could probably use an update. What was that, 2011? I'm getting a little,
Wild.
it's been a minute.
Speaking of, I don't know, Jamie, you might, I'm sure families would be interested in this. The personal needs allowance. We were working very hard on this right before the pandemic to get that amount increased for both nursing and personal care homes. Have you heard anything further from legislation on those
No,
increases?
but we are still working on that. So if anybody wants to, maybe we can take a look at some of those paperwork. Maybe we can coordinate that for family members to assist as well with the personal needs allowance. That's something that has been stagnant for many years. And let's face it, it just doesn't go as far as it used to. For these, especially for the nursing home residents, they don't get much at all. So definitely something we can work on. We could put that on our agenda. Because I don't think the families even know that we've been working as ombudsman for that for, oh my, how long was that since we pulled that out? About 5 years we've been pulling that.
I think 2017 maybe is when we started the surveys for residents. I know there was a gentleman who was going to continue to grow his beard until they got the increase in personal needs allowance. I don't know if he kept up with that, but he'd have a pretty long beard by now. So.
Yeah, these are fantastic ideas. Everybody keep them coming. Let me tell you, with it's just being the 5 of us, we're drying up the well over the past 2 years here. One of the ideas I had recently was maybe we could do something with what services may be out there from like the Blind Association, as visual impairments have a tendency to, grow as we age. I've already got some, so it's not looking good for me. I thought that might be a good thing for us to reach out to. And then the Deaf of Hard of Hearing Association, I'm going to try to get with Kay Tyberg, see if we can get somebody from their organization to share some things with us. And Linda, understanding
does-
dementia.
Yeah, she's interested in still, hearing more and more about dementia.
Absolutely. And I did post something on our Facebook page about there's a Dementia Series coming out for us. It's called Us Against Alzheimer's. And it's a series. It's from, I can't remember, it's the Brain Academy. I put all the details on our Facebook page, but it's all free. And it gives continuing education credits too for certain folks. If you have to double dip for personal and professional there, it works out very nicely. But they do fantastic webinar series. And if you sign up for that, you can always catch the recording if you can't attend it live.
Our work group had also spoken about caregiver coping and the stress that all you family members have been under. Is that something we've touched on that before? I think at least once or twice. Is that something family members would be interested in hearing again? Having kind of a coping for caregivers session? Maybe not.
Caitlin says definitely. I was sort of wondering, about the veteran services. I don't know if we've ever really had anybody talk about that, because a lot of times, like the spouse of a veteran could get things, but it's very complex, but I don't know if that would be of interest to people or not.
That's a good idea, Carol. We've never ventured into that, but I know one of our previous ombudsman is now in Veterans Affairs. Miss
Ooh.
Gloria Eshelman is now over there.
Oh, yeah?
Yeah.
Wow.
That would be great to hear her come and speak about that.
Oh, thank you, Patty. We got another yes for family caregiver coping.
Okay, Linda has a suggestion to have maybe an elder law attorney or a person for their office explaining how to deal with loved ones' bank accounts, pros and cons, because POANZ death, explaining short certificates, etc. So maybe you're talking about after a person dies, what needs to be done, or both, maybe.
That's an excellent suggestion, Linda. We haven't done that yet, so that'd be good for, planning purposes, and maybe some of us have to, a little bit of housekeeping on our end as well, things that we could get in order. Definitely.
Okay, also wondering about nursing home insurance, or for home health coverage. Let's see. Medicaid benefits.
Yeah, I was specifically because I'm an ombudsman and I am constantly talking to residents who don't know the expectations once you're on Medicaid at a nursing home. And they're quite shocked. And they either owe tens of thousands of dollars to the home because they didn't realize their obligations or don't realize what benefits were available to them. Even that personal needs allowance is building up and they have an account they didn't even know they had money in. Or that haircuts are free if you're on Medicaid. So there are a lot of benefits to residents in nursing homes, even though they take almost your entire income. They should at least know the ins and outs benefits and unfortunately the drawbacks of being on Medicaid in a center, especially even someone in a personal care home who is potentially going to end up in a nursing home should know what to plan for and that they perhaps can't gift money to a family member or else that makes them ineligible for Medicaid. So there are some really important factors, no matter what level of care you're at, you should at least be aware of.
Excellent point there, Corey. That's something we spend a lot of time talking about and might be good to get it on a video that anybody can have access to. I did want to put it out there too. Somebody had mentioned, you know, they don't have a lot of connections with Facebook. Do you feel it would be beneficial if we uploaded our videos on like perhaps a YouTube channel as well? So I wanted to put that out to the group for discussion. Because I mean, it's not hard for me to create a YouTube channel and hit upload to 2 different sites. It's not a big deal on my end. So, okay.
We had a comment from Patty about coping for people that are caregivers in the community as well as a caregiver for someone in a facility. Linda Gibson said about pros and cons of having both persons' names on accounts while the person is considered capable of doing that prior to the diagnosis of dementia. So I'm thinking maybe she means the power of attorney or somebody else having their name on the resident's account. And Susan said, I hear situations where due to a declining health in a POA, I don't know, for some reason this is jumping around. So I'm not sure if I can read the end of that.
Looks like they decline and then the power of attorney goes into effect and then a resident gets better and now the power of attorney isn't appropriate or doesn't have the best interest of the resident in mind. So those things definitely do happen, Susan. That's a good point.
And people seem like they like the idea of the YouTube video, a channel.
Well, I guess we can look forward to us premiering that as well. It's like everyone says yes to YouTube, so we will definitely make that happen for you. I think it's easier to share as well because you don't actually have to have a sign up or a subscription. You can view videos from anywhere. So I'm happy I brought that up for everybody.
And you can set alerts to be notified when videos are posted, because for some reason I can't figure out Facebook to alert me of things that are on there. I don't even get alerts when people private message me. So it would be really great to have that YouTube version.
I've been struggling with that as well, and I'm the admin for everything, so that scares me. So luckily Caitlin's been able to help me with that as well. Absolutely, Patty. I can post I have all of the videos saved. I have an external hard drive, so starting back from May of 2020, I have all of them here. So we can put them all up there with the dates and topics real specific for everybody.
I know Corey mentioned about Medicaid, but I'm also wondering about Medicare. You know, there's always a lot of people feel, well, I'm a senior citizen. I have the red, white, and blue card. So I have 100 days of coverage in a facility, a nursing home, but that isn't really how it plays out. That might be interesting for people to understand or hear about anyway. Maybe.
Absolutely. Great ideas. And this discussion doesn't stop when I end the meeting. So if anybody has any great ideas, I know they usually come to me much later. I'm a night owl, so it'd probably be in the early AMs. You can always send us an email. Or if you do get on the Facebook, you can message us. We will eventually get it. I'll be looking out for them particularly.
Linda is wondering, she says there is a person that in her county that goes into facilities and tests their cognition for dementia. And she's wondering how objective is this analysis? And do they do that everywhere?
They should. That's kind of an area specific. You have certain licensed professionals that are able to do that, and some do travel into facilities. A lot, I know I'm in Blair County. I worked in Blair County for quite a while. We only had one that would go to facilities, but two that would take you from the facility to their office for the evaluation. So it does vary area to area, but they are out there.
But then also like in like a nursing home or something, typically it is like the social worker who would be doing like maybe every 6 months or when there's a significant change or a decline, like a mini mental or what they call a BIMS. It's like just only 10 questions or something, or what they used to call a slums. They got all these little tests like that, and they put them in the chart to see, like they're going to ask who's the president, what day is it, how old are you, this and that, some short-term memory questions, and then some long-term memory questions. But those are like tools that they use in facilities or even in home services type things, but they're not like by a psychiatrist or a psychologist like Jamie was talking about, but they do those assessments all the time. Part of the MDS to do their care planning is having to do with asking questions on cognition. Oh, an assessor talking about doing their job, like assessing their level of care, you mean? I think you, Linda, probably means that, like an assessor from the area agency on aging, deciding if they're in the appropriate level of care, maybe.
Yeah, I'm not sure if she was talking level of care or perhaps like a psychiatrist, psychologist, because I know Linda Shoemaker had discussed a little bit about that in two of our previous sessions. So maybe we can even link that up for you, Linda, to check out Linda Shoemaker's presentations, because she discusses a lot of the process on evaluations for dementia.
Yeah, that's what Linda wrote now, that she's interested in knowing what level of dementia the person is at.
Perhaps we can reach out to the Alzheimer's Association too, to see if they have any new materials. I know they had a really fantastic video series a couple years ago that they did with HBO that was phenomenal. But that's been a while. Excellent ideas, everyone.
Just so everybody knows, I think it would be helpful for us to, I've Googled BIMS and looked up, that's that cognitive test, and that's what most nursing homes use. It is shockingly short, and I would definitely recommend you don't just rely on the BIMS, even though that is the standard cognitive test. It goes much deeper than that, obviously, but nursing home, it's a 1 to 15 test, and nursing homes usually say, okay, they're 15 out of 15. They're good. We're going to go with whatever the resident says, or if they're under a certain level, I think it's maybe 7 out of 15, then they're significantly impaired cognition. And then they almost totally ignore what the resident has to say. So that you do want to find some kind of middle ground there where you're considering more than just that BIMS score, because it's not all inclusive to what you should be considering.
Absolutely. And I know I've had several residents who have gone through the evaluation, as Linda was referring to, with an actual psychiatrist. And what they have a tendency to do is come and do more than one visit. I worked with one particular that she would do 3 at a minimum. She would come morning, afternoon, and evening, and make sure, throughout a couple days in between, to really test what their quote unquote normal or baseline would be. So I think it kind of varies what system, then what test they might want to use. Excellent questions, though. Great discussion on this, everyone.
I don't know if any of the families that are on here have faced like a facility closing, and then they have to find a new place for their relative. I'm not sure if that would be pertinent or not.
Well, that's a good idea, Carol, because, we've had quite a few big announcements of closures across the Commonwealth as of recently. So I think that could be timely.
Now, when I was on a couple of weeks ago, and Philadelphia said that their main nursing home was closing or something like that. I think I heard them say that from Carrie.
Mm-hmm.
So that is happening or did happen.
That announcement did come out, yeah. So it's their only county nursing home.
Mm.
Yeah, so that's definitely, rights during a closure would be something to cover, and things that they should be explaining to families.
Okay, and we have a comment on here of one of Karina's facilities is set up with an evaluation with the psychologist. The testing was virtual shopping, making change, checks books, separating medications, and various steps. So it almost sounds like life skills or something like that they did with them.
Wow. That's awesome. I see we're getting to the end of our time. So our upcoming meeting schedule. So we got meetings on July 12th and 26th, and our topics will be announced. As you can hear, we have a lot of A lot of great ideas. So we will make some finite speakers and topics for those and make sure we get that out to everyone as soon as they are they're booked and official. We'll make sure we get those to you. And then we'll hopefully be able to plan out a couple of months ahead. That's how I definitely like to do it. I don't like week to week planning. So hopefully we'll be able to get some great speakers on these topics.
Linda is in agreement about some people that are not that involved with their relative or loved one's care might not even, understand about closings and things like that.
Sure, that would be a quite shocking letter to receive if you haven't been in contact. So yeah, that's definitely a sad reality that we have to deal with, or it's one family member that has been dealing with all of it, and that makes it really difficult too. So I thank everyone for these fantastic ideas. Sounds like the work group, we have our work cut out for us, but we got some great topics out of this. And again, if anybody wants to join our work group, just shoot me an email and we'll get you all the connection information for that. We're a really laid back and easy group, so we'd love to have you. Yeah, and thanks to everyone for participating this evening. Any questions or comments, you can send those right over to Jay at the State Ombudsman Office. So ltc-ombudsman@pa.org, or you can check out that Facebook page. It doesn't sound like a lot of folks like the Facebook, so we'll be working on that YouTube channel for everyone as well. So thank you all and have a great evening.